If you are over 65 and your eyes have started playing tricks on you, headlights look like exploding stars, reading a menu feels like squinting through fog, and colors seem duller than they used to be, then please do not skip this video, because what I am about to share could save you from a decision that thousands of seniors regret every single year. Cataract surgery is one of the most common procedures performed on people over 60. And doctors love to tell you it is simple, quick, and almost risk-free. But here is what most patients never hear until it is too late. The decision that matters most is not whether to have the surgery, it is when and which lens you choose. And if you get either of those wrong, you could be looking at blurry vision, glare, halos, or even a second surgery for the rest of your life. Let us start with the biggest mistake, and that is waiting too long. Many seniors think, my vision is not that bad yet, I can wait another year, maybe two. But cataracts do not pause and wait for you. They grow slowly, silently, and the longer you wait, the harder and more brittle the lens inside your eye becomes. A soft, early-stage cataract is far easier to remove than a hard, mature one. When surgeons operate on an advanced cataract, they need more energy, more time inside the eye, and that raises the risk of complications like swelling, inflammation, or even damage to the delicate structures that protect your vision. So the first myth to throw out today is this idea that waiting is the safe choice. In many cases, waiting is actually the riskier choice, not the safer one. Now here is the second mistake, and this one shocks people, choosing the wrong type of lens for your lifestyle. When your cloudy natural lens is removed, it must be replaced with an artificial one, called an intraocular lens, or IOL. Most people assume there is just one basic option, but in reality there are several, and each one changes your life differently. There is the standard monofocal lens, which is what many public health systems and even many private hospitals will offer you by default, because it is the cheapest and simplest option. A monofocal lens gives you clear vision at one distance only, usually far away, which means you will likely still need reading glasses for the rest of your life. For some people, that is perfectly fine. But for others, especially those who love reading, sewing, gardening, or working on hobbies up close, this becomes a frustrating daily reminder of what they lost. Then there are multifocal and extended depth of focus lenses, which are designed to give you clear vision at multiple distances, near, middle, and far, reducing your dependence on glasses altogether. Sounds perfect, right? But here is the catch nobody warns you about. These premium lenses can sometimes cause glare, halos, or starbursts around lights at night, especially in the first few months after surgery. For someone who drives at night regularly or who is highly sensitive to visual disturbances, this can be a real problem, not just an inconvenience. This is why doctors who truly care about your outcome will ask you detailed questions about your lifestyle, your hobbies, whether you drive at night, whether you spend hours reading or on a computer, before recommending a lens. If your doctor recommends a lens in under 2 minutes without asking any of these questions, that is a red flag, and you deserve a second opinion. The third mistake almost nobody talks about is not accounting for other eye conditions you might already have. Many seniors also live with dry eye, glaucoma, or early macular degeneration, and these conditions can dramatically affect how successful your cataract surgery outcome will be and which lens is even appropriate for you. For example, if you have significant dry eye that goes untreated before surgery, your measurements for the artificial lens can be inaccurate, which means even a technically perfect surgery could leave you with blurry or shifted vision afterward. This is why a thorough pre-surgery evaluation is not optional. It is essential. If your eye doctor rushes you through pre-surgery testing, treats dry eye as an afterthought, or skips detailed corneal mapping, you are being set up for a result that may disappoint you. Now let us talk about timing again, but from a different angle, the mistake of having both eyes done too close together, or in some cases, too far apart. Most surgeons today recommend doing one eye first, waiting anywhere from 1 to 4 weeks, and then doing the second eye once healing and results from the first eye are confirmed to be excellent. Why does this matter so much? Because if something is not quite right with the lens, power, or healing in the first eye, adjustments can still be made before the second eye is operated on. If both eyes are rushed through surgery back to back without this waiting period, and there is an issue, you could end up with the same problem in both eyes, doubling your regret. On the other hand, waiting too long between the two eyes can cause a strange imbalance, where one eye sees clearly and the other is still cloudy, which can affect depth perception, balance, and even increase your risk of falls, something extremely important for seniors to consider. Here is a mistake that seems small but has massive consequences, ignoring the surgeon's experience with your specific type of cataract or lens choice. Not all cataract surgeons are equally skilled with premium lenses, and not all of them perform a high volume of the specific procedure you may need. If you are considering a multifocal or toric lens, which corrects astigmatism, you want a surgeon who performs these regularly, not one who does a handful a year. Do not be afraid to simply ask, doctor, how many of these specific procedures have you personally performed, and what is your complication rate? A confident, experienced surgeon will answer this question directly and transparently, without hesitation or irritation. If you sense defensiveness, that tells you something important too. Let us also address the emotional side of this decision, because so many seniors go into cataract surgery feeling scared, rushed, or confused. And that emotional state leads to poor decision-making. Some patients say yes to whatever lens is offered simply because they trust their doctor completely and do not want to seem difficult by asking questions. Others avoid the surgery altogether out of fear, even when their vision loss is seriously affecting their independence, their driving, and even their risk of falls at home. Both extremes, blind trust and paralyzing fear, can lead to the wrong outcome. The healthiest approach is somewhere in the middle. Be respectful of your doctor's expertise, but also be your own advocate. Ask questions, request time to think, and if something feels rushed, slow it down. One more critical point: insurance and cost pressures often shape recommendations more than most patients realize. In many healthcare systems, the standard monofocal lens is fully covered, while premium lenses require an out-of-pocket payment. This financial reality sometimes means doctors default to recommending the cheaper option first, not because it is medically superior for you, but because it avoids an awkward conversation about cost. This is not a criticism of doctors as people. Most are doing their best within a broken system, but it means the responsibility falls on you, the patient, to ask, what are all of my lens options, not just the one covered by my insurance, and what are the pros and cons of each, for someone with my specific lifestyle. So what does getting this decision right actually look like? It starts with getting evaluated as soon as symptoms begin interfering with your daily life: glare while driving at night, difficulty reading small print even with your current glasses, colors appearing washed out or yellowish, frequent changes in your glasses prescription. Do not wait until you are legally unable to drive, or until your vision loss has already caused a fall. Second, insist on a full lifestyle conversation with your surgeon. Be honest about how much you read, whether you drive at night, whether you are highly sensitive to visual side effects, and what your realistic expectations are for glasses independence after surgery. Third, ask about all lens options available to you: monofocal, multifocal, extended depth of focus, and toric if you have astigmatism, and understand the trade-offs of each in plain language, not medical jargon. Fourth, make sure any other eye conditions, dry eye, glaucoma, early retinal changes, are properly treated and stabilized before your measurements are taken for the artificial lens. And fifth, choose a surgeon who is transparent about their experience, their complication rates, and who does not rush you into signing consent forms without answering every single question you have. Cataract surgery has genuinely restored independence, safety, and quality of life for millions of seniors around the world. And when done thoughtfully, it can feel like getting a completely new pair of eyes. But the patients who are happiest with their results are almost always the ones who took the time to understand their options, asked uncomfortable questions, and refused to be rushed through one of the most important decisions of their later years. Your eyes are not something to gamble on convenience or a quick appointment slot. They deserve the same careful thought you would give to any major life decision. Because clear vision in your 70s, 80s, and beyond is not just about seeing better. It is about staying independent, staying safe, and staying fully engaged with the people and moments you love most. If this video just answered a question you have been quietly worrying about, or gave you something new to ask your own eye doctor, then you owe it to yourself and to every senior in your life you care about to hit that subscribe button right now. Because we release videos just like this one every single week, covering the health decisions that doctors rush through in a 15-minute appointment, but that deserve real, honest, in-depth explanation. Subscribing costs you nothing, but the knowledge you gain here could protect your vision, your independence, and your quality of life for years to come. So do not scroll away and forget, hit subscribe, tap that notification bell, and join a growing community of seniors who refuse to make major health decisions blindly, pun fully intended. We will see you in the next video.